Welcome to the MS&Me Radio Network, a division of the Multiple Sclerosis Global Support Network. The following program broadcast is an original creation by the broadcast entity. Discussion within the following broadcast should be used for informational purposes only and is not a substitute for professional medical advice or consultation. Before considering application of any broadcast content in the following program, please consult your healthcare provider. If you feel you are having a medical emergency, please contact your local health services for immediate assistance. MS&Me Media and the Multiple Sclerosis Global Support Network do not guarantee or warrant the accuracy of information in the broadcast to follow. The Multiple Sclerosis Global Support Network provisions broadcast services to program hosts. Information discussed in the broadcast does not necessarily reflect the views, opinions, or goals of the network and are solely those of the show broadcast host. Should you wish to host a broadcast, please visit our website at msmemedia.com and submit a request to become a program host. We thank you for listening to the MS&Me Radio Network. Enjoy the show.
Hello, and welcome to another, that sounds very Sheldon-like. Welcome to another episode of A Couple Takes on MS on MS&Me Radio Network. This is Dan Digman.
Hi, this is Jennifer Digman. And if you didn't understand that Sheldon reference, that's from The Big Bang Theory. And Dan, honey, you didn't sound anything
I
like
was just
Sheldon.
like, hello, welcome to Fun with Flags. Yeah, so no, really, this is a great time. Thank you for joining us. Actually, whenever this airs, we are outside on probably one of the last nicest days of summer/fall.
Right. It won't be fall until next week, but
the autumn of September.
Yes.
That will be here. And thank you so much for joining us. And tonight, the subject, the title of this program is Doctor, taking MS and treating multiple sclerosis.
And so let me ask you a question to my fellow MS community. Are you tired? I mean, do you feel fatigue right now? Because I'm very happy to report that Michigan medicine researchers recently were awarded nearly $3.5 million to fight fatigue in multiple sclerosis. A new clinical trial will explore 3 interventions in improving one of the most disabling symptoms for the people like you and me with MS, fatigue. The Patient-Centered Outcomes Research Institute has approved a $3.5, give or take, $million award over 4 years to Michigan Medicine's Tiffany Braley and Anna Katz. Dr. Tiffany Braley is my neurologist, so this is especially exciting. I'm so happy for her, and I'm also happy for myself and for Dan and for all of us in the MS community. To find out something about fatigue, Dr. Braley is going to lead a clinical trial focusing on 3 interventions that are used to treat fatigue. She's going to look at medicine, cognitive behavioral therapy, and a combination of both treatments.
And I think what's exciting about this, I mean, in and of itself, that's exciting news for the MS community. But I think what's equally as exciting, it's like, that's your neurologist that you've had for how many years?
And Dr. Braley and I have gone back probably 9 years. And I want to say I was one of Dr. Braley's first patients because the University of Michigan, go blue, the hospital and the healthcare system is where I see Dr. Braley. And she was in her residency, I believe that's the proper word, when she started. And so she finished her residency and became my neurologist, which is she's a great doctor and I feel very comfortable with her. And so I'm so happy to get to share this exciting news for all of us again in the MS community. But Dan also has some exciting news.
Well, I think this really then ties into the subject, and what we're going to talk about in this program is Dr. Braley actually is now going to be my neurologist.
Woohoo!
It's so exciting, I think, just because I go with Jennifer to all of her appointments. I think it's like Dr. Braley's kind of been my surrogate neurologist. What happened is my neurologist, Dr. Call, who I've had since I was diagnosed 18 years ago, he's retiring. And I don't think I ever would have left Dr. Call because he's been a great neurologist for me. And fortunately, he's within the U of M health system, so then I could transfer to Dr. Braley. But our question to you is, how do you know when you have the best neurologist, when you have the best doctor, and what do you do to determine, or when you know it's time to find somebody new?
And unfortunately, I'm a little close to that question because I did have a neurologist when I was diagnosed first. And he was in my hometown, and he was a great doctor, and I really liked him. But as I progressed, as my disease progressed, it became clear that he was not going to treat my MS as aggressively as I thought he should. And so that's when I sought treatment down at the University of Michigan. So for me, having a doctor that I really liked was not important enough. I needed a doctor to be aggressive.
And I think that's where I think that's the question is, like, there are people who also had Dr. Call, my neurologist, did not like him. And it was just like always a question of, what is it you're looking for in your neurologist? And I think if people were looking for somebody with cuddly bedside manner, I don't mean that in a negative way, because some people, I mean, that's what we need. Dr. Call was not that way. He was caring, but I think it was like he didn't sugarcoat things.
No, and he told you honest, and he certainly was sensitive of your feelings, but he never, I think sugarcoated's a great way of saying it. But leading a self-help group as we do here in Michigan, we listen to some of our group members talk about the problems they have with their neurologist, whether it be an age or gender difference, or a language barrier, or just a health system where their insurance will no longer let them continue treatment with their neurologist. So there are a number of reasons, and some of them are outside of your control, but I think it's really important to have a close relationship with your doctor.
And I think that's always the question too, because yeah, there are things that are your control, but then it becomes really more personal preference. I mean, so, Jennifer.
Yes, Dan.
What are you looking for? I mean, we never really have these conversations. What are you looking for in a neurologist when you, obviously you talked about needing somebody who was aggressive, but I mean, at that point in time, he had been your neurologist for how long?
He had been my doctor for about 5 years.
And why did you stay with him?
I stayed with him because I really liked him, and he treated me very well. And as silly as this sounds, I didn't know that I could expect more from my doctor. That when my health was starting to deteriorate, I needed to ask the tough questions and say, doctor, are we being aggressive enough? What about this therapy that I read about? And he was not, and I don't want to say this is, this again is personal preference, but he was a neurologist that saw a variety of patients. Whereas Dr. Braley and the U of M health system, where I see her, is an MS clinic. And so they see only MS patients. So they're really with their fingertips on the pulse of new research and new medication and just really exciting things. And that really attracted me to her one of the doctors in the practice. And eventually he left the practice and went on to bigger and better things, and I got to fortunately have Dr. Braley treat me.
And I think that's always the big question is like, what is it you're looking for in a neurologist? I mean, I wanted somebody who would just be honest with me and be matter of fact, understand that I am a patient and have questions, but never undermine or undervalue the questions and concerns I have. And I think that's where Dr. Call did exactly what I needed, because I didn't want him to hold my hand. And I didn't want him to sugarcoat or make it sound better than it was.
So I have a question for you, Dan.
Please.
Dr. Call was the same gender as you. You were both men. You are going to see a female neurologist. Do you have any reservation or doubts about that? Or has that even played into is that a question you've even asked yourself?
Not until you asked it, so thank you very much.
You're welcome very much. But
I really don't. I don't think that's for me. That's not a concern. I think that I suppose I also have the benefit of knowing Dr. Braley through you and knowing just the just a high amount of respect I have for her,
right.
And I trust her judgment. But I mean, then how did you know with Dr. Braley? How did you know? Other than having the I don't want to inflate U of M's ego or anything, but I mean just having that stamp of approval of the University of Michigan, is that something that does that give them more credibility or instant credibility in your book?
I believe that gave them instant credibility, but there's a nurse, Nurse Catherine Bennett, who also will be taking part in this research with Dr. Braley, that I've always has been at U of M while I've been there. And I really, really liked her, and I felt confident because when that other neurologist left and I started seeing treatment with Dr. Braley, Nurse Kathy was still there. And so I think, like for you with Dr. Call, I'm sorry, I just had a brain fart, but you in the MS community understand that. He had a nurse that you really, really were fond of.
Well, and it has nothing to do with the fact that her name was Jennifer.
Uh-huh.
I think because I was always difficult when I start talking about Jennifer in the sense of my nurse, and people at the office would wonder what I was talking about. Well, because truly you are the only Jennifer.
But it is those things that go into a neurologist, finding the right one. It's maybe, would you agree, more than just the neurologist, but the health system and the staff that surrounds him or her.
And I think that's totally what it is. It's just like in many senses, our treatment, our dealing with this disease, and I say ours with a big O, meaning everybody out there listening, and with between Jennifer and I, this truly, in taking care of our health and our MS, it's a total team effort. And I think that's where your neurologist is part of the team, but then also everybody on their staff is part of that team to make it complete and full. I think had been several times over the 18 years I'd call over with a question for Dr. Call, but I would just go I'd have Jennifer right there, the
nurse
Jennifer, and I would ask her the questions, and so you build that, and I think that has a lot to do with it too, is building that trust that you have with them. And I think that when we're all out there dealing with neurologists, if you don't trust that you're getting the best care or trust the people who are at that place, then I think those are times where you truly owe it to yourself to find something better.
Yeah, I agree, because I know that when I treated neurologists, I was sad to leave my first neurologist, but thank heavens I did, because I found doctors that treated me a little more aggressively, and they at that time slowed the progression of my disease, and that made a huge impact and a big difference in the quality of my life.
And I think, when we talk about treating things aggressively, that ties into something that we all need to do, and we all need to be our own best advocates in dealing with this disease and being informed and being knowledgeable and asking the tough questions to make sure that you're getting the right care that you deserve.
Because you do deserve it, and your family deserves it. Woo. I just am sitting forward, sorry. I was a little uncomfortable. But I think you need to be really proactive, and you need to be your own best advocate, and not wait. I don't regret not leaving my first neurologist sooner, but I think if I had 20/20, or if I could do it over again, I would have perhaps left that first neurologist sooner and been a little more aggressive. But hindsight is 20/20, and I'm just thankful that I did.
I mean, how did you know that at that point that you went into the first neurologist and you realized he wasn't being aggressive? I mean, he didn't come out and say, "Hey, Jennifer, I'm not being aggressive enough on your treatment." How did you know that he wasn't being aggressive?
That's a really funny question. Not funny, haha. It's just a very interesting question. I had a woman that worked for the National Multiple Sclerosis Society that I respected a great deal. And she sent me a note, an actual pen to paper note back in the old school days. And she just said, I'm concerned that you are getting worse, and maybe, I'm only saying this because I care about you. You should think about looking at another doctor. And initially I was somewhat upset by that. But then when I read about another up and coming treatment, and my neurologist said, I'm just not comfortable doing that, I had to make that choice, stick with the doctor that I liked, or do the best to preserve my health.
Well, I think that's just, when we're living with this aggressive disease, and this isn't to freak us out or to make us feel like totally under the gun all the time, but it's like time is important. I mean, you can't delay.
You can't get it back. You can't delay, or you can't get it back.
And so it's like it's so urgent to treat things aggressively or to be on top of things, and that's where the knowledge, the understanding, that's why it's so important to, like for your example, staying connected with other people who can help you deal with these things to keep you informed. That's why with MS self-help groups, with being on the internet, with being and obviously trusting and
using credible sources like we've talked about before.
That it's just like making sure, and because I know that especially like in the last 18 years, think of how many MS drugs, how many disease-modifying drugs or enhancement medications like the Empira and
right,
and just everything that helps you. I mean, to go to my neurologist, I'm the one asking him the questions, and I want his opinion. I think that's where it is. It goes back to that trust issue where I trust him for his judgment, what he thinks. Obviously, yes, I'm going to take my own opinions, because a lot of times I would ask him about new medicines, and he would give me his opinion, and he would ask me, did I want to try it? I think it's like he gave me his decision or his opinions, but always left it up to me, and I think that's where that whole trust, and I think that on some levels, for as much as your neurologist has to earn your trust, you have to earn his or her trust in you as a patient. I think that's where we talk a team effort, where it's like truly a cliche, teamwork makes the dream work.
Absolutely, but it does, because if I am not up on the latest and the best information possible, I'm sure that Dr. Braley will tell me about it, but it makes the conversation so much more powerful when I can say, Dr. Braley, tell me about Empira, or tell me about Provigil, or Ocrelizumab, exactly, a new treatment. Just tell me about that, and that, again, that makes it more engaging for both of us, and it makes the appointment time more valuable. And if you remember what we said before, with the neurologist appointment, write your questions down and really use that time to the best of the best to treat you, because they're not long appointments. and you have a lot of information to cover in that time. But anywho, on another point, since we're talking about your doctor retiring.
Talk to me about your other doctor retiring, Jennifer.
Sort of sad news. My doctor didn't retire, but one of my most important members of my healthcare team, she took a new position at a different hospital, and she's no longer seeing patients, and that's my urologist. And so I was initially kind of devastated, and I'm not being dramatic, but I've been fortunate to have the same urologist for the last 12 years.
Yeah.
And so when I got that letter in the mail that she was no longer seeing patients and she was referring me to maybe 3 other doctors, I was, would you say, dumbfounded? I just couldn't.
Devastated was one. I mean, I was shocked too, just aware that's your mainstay. I think that's like with Dr. Call. I've had MS for 18 years and I've known nothing other than him. And so for you with your urologist,
I've never known anything than the doctor that I had. And she, as I said, recommended and referred me to other doctors. But that was somewhat devastating. And I will find another urologist, but living in the middle of the mitten, as Dan and I do here in Michigan, it's a little more remote. The closest, there are a few doctors here in town, but most of them are about 45 minutes away. And if I want to see another doctor, say a urologist at the University of Michigan system with Dr. Braley down in Ann Arbor, that's 2 hours away. So
on a good day.
Yeah, on a good day, factoring traffic. But it is that specialist, a neurologist or a urologist. Those doctors are really important, and so I will keep you, our dear listeners, posted when I find one, because I'm not giving up and I'm not just saying, oh, my doctor's gone, I'm done. I'm going to find another one because it is a really, really crucial member of my team.
And so let me ask you this then, on one level, how much do you love me?
I love you very much.
Okay, well then I don't want to say turnabout's fair play, but then let me ask you this, Jennifer. So you would ask me, as far as Dr. Braley and Dr. Call, I mean, he was a male, she was a female. You had a female urologist. How important or fundamental is it for you to find a urologist who is a female or a male, or are you indifferent?
Well, that's interesting, because one of my brag points has been that my primary doctor is a female, my neurologist was a female, and my urologist was a female. So it was important to me. But I'm not sexist, and I know enough that a male primary doctor is awesome, because I had one and I had a male neurologist. And I suppose we did have a speaker that we saw when we went to an MS support group meeting. He was a wonderful urologist here in town. And obviously, because I called him he was a male. So maybe I will look and see if he's accepting new patients. Boy, that was a tough question.
Well, I wasn't trying to put you, because you would ask me, and I thought it was a very interesting question with, Dr. Call versus, male versus female, and I was like, is it different depending on what levels of things? Well, because I had always had, Dr. Our neighbor.
Dr. Striebel.
Dr. Striebel was a male, and so I had no problem going in for any kind of assessment and stuff, and he was a male, and now our primary physician is a female, and I'm like, I think from my perspective, they all are doctors, and I just think I'm sure they don't necessarily see gender there, by then I don't either, so I think I just want the best person for my care, and I think that's where you do your homework, not only on your medicines and stuff, but do the homework on the doctors, or get opinions from other people who have, patients who have seen these doctors and get their opinions.
And our self-help group didn't meet in the month of September, but we will meet in October, and maybe I will take that question to our group, just because that's other in the MS community with urologists, and see if they refer me or recommend anyone. But that is a good point, because the speaker that we saw, the male, a few months ago, that was at an MS self-help group meeting, so someone with MS thought highly enough of him for him to talk to us.
And I think
Good point, Dan.
Well,
I won't be sexist.
Well, you brought it up, and I was just like, I never once flinched to think that, oh, well, Dr. Braley's a female, but I think that's where her reputation, and I've had experience because I've went to her with you, and so I think that's where just finding the opinions from other patients of that doctor, whether it's a neurologist, urologist, primary care physician, just like get opinions of the people that you value, because that's the only way that you're going to be comfortable to open up to the doctors. And so something to just throw out before time gets away from us, a lot of this is like Jennifer and I talking about things, but we would love to hear from you. And if you can reach out to us, go to our website at danandjenniferdigman.com, or find us on Twitter at danjendig, and just check in with us and just tell us, what are you looking for in a doctor?
Am I being silly, or are we being silly, or is it a good thing that we're being open to each doctor individually? What criteria do you look at with a doctor? Because we would love to hear from you, and I think every opinion matters, so that's important.
And so that's like I say, I wanted to check that before time got away from us. But we hope that today's show helped you at least to think of perspectives on what it is, or knowing when it's time to find a new doctor, like just to think about what it is you're looking at or looking for in your physician, in your neurologist.
And thank you for letting us talk to you, because I really did some exploring and talking with Dan and asking and answering some questions. So thank you, and join us please next week. And if you have questions, reach out to us.
Thank you again, and we appreciate your time, and thanks to the MS&Me Radio Network for inviting us to be here with you, and thanks to Blue Giraffe Kid for composing the theme title music for our show. And until next week, have a good time. Take care.